Hello, and welcome to this Facebook Live event, WHO Europe Answers, broadcast from UN City here in Copenhagen, Denmark. Later this week, on Saturday, will mark the one-year anniversary when WHO declared COVID-19 a public health emergency of international concern. Now, the pandemic continues to affect our everyday lives, with vaccines and variants, mutations and lockdowns continuing to dominate the headlines and to dominate our day-to-day conversations around the world. The next 45 minutes or so is your opportunity to ask us here at WHO your COVID-19 questions. I'm delighted to say that we are joined by Dr. Siddhartha Datta, who is the Regional Advisor for the Vaccine Preventable Diseases and Immunization Program, and by Dr. Catherine Smallwood, the COVID-19 Incident Manager for the WHO Health Emergencies Program. Now, we are broadcasting on Facebook, on YouTube, and on Twitter. So if you would like to ask us a question, please feel free just to use the comment section or via the hashtag WHO Europe Answers, and we will endeavor to answer as many questions as we can over the next 45 minutes or so. But to start this off, I would like to ask the first question to Dr. Siddhartha Datta. Sid, we've heard a lot, especially lately, about the COVID-19 variants or mutations. Can you tell us, will these mutations make the vaccines that are currently being rolled out less efficient?
Yeah, thank you, David, and good to be part of this discussion with Katie today. So let me take a moment to divide my answer into two different parts, because both vaccines, which we see at this point of time, the COVID-19 vaccine, is a new tool, a very effective one in the fight towards COVID-19. So that's a new implementation of the COVID-19 vaccine rollout that we are seeing in several countries. Other part is, which you mentioned about the variant, that is also a new entity within this COVID-19 virus framework, if I can put it that way. So we are learning both these entities more every day. So we are learning about the variants, how it is behaving, the infectivity and other things, which I'm sure Katie will have more insights on. But for the vaccine rollout, we are also learning more about its own characteristics and how it will behave in different scenarios. At least at this point of time, the evidences that we have, the more we see, there is no effect on the vaccine, on the SARS-CoV-2 variant on this vaccine. The vaccine's effectivity stays. But however, these are all early days. We need to keep a close eye into how this vaccine will behave as the SARS-CoV-2 variants infection will be much more closely monitored by WHO and other international community.
Great. Thank you so much for that. Katie, as I mentioned during the intro, this is now 1 year on, almost, from when WHO declared COVID-19 to be a public health emergency of international concern. In hindsight, looking back over this past year, is there anything, in your opinion, that WHO could have done differently in its policies, or could have done better?
Yeah, thanks for that. And reflecting on a year of COVID is quite sobering, and it's sometimes difficult to pull myself out of the thick of the operations and be able to take a step back. But at the moment, there's quite a lot of discussion around what WHO might have done better, what WHO may have done quicker, and how we look back on the very specific challenges that are posed by a pandemic such as this, which is a once-in-a-century type of event. From this perspective, and from the regional office here in the European region, where most of our work has been really directed at supporting our European region countries, there are lots of things that have stuck out in the last year. Before the event was actually declared a public health emergency of international concern, we activated what we call our incident management system, which is the the standard apparatus that we use to manage urgent and acute events, emergencies in the European region, but also globally. And we were able to start work very early on, in fact, and before there were any cases detected in the European region. So I think when we look back on the things we need to improve, we should also think about how we've done things well, and that was an early action that the European region took. But what we didn't see coming was really the way this pandemic, as it would become, really touched every one of us, whether we were involved in the response or whether we were affected by it as individuals, families, communities, etc. But also how it changed the way we had to operate. And that's something that we weren't able to foresee. So the fact that our ability to deploy teams from one country to another to support was completely debilitated in the midst of the pandemic by the fact that international travel became very difficult. The fact that our virtual stockpiles and agreements with suppliers for emergency kits and other supplies to manage COVID broke down completely, and we didn't have a recourse to go to. So this delayed our ability to really get the most needed life-saving supplies into countries. But I think most of all, I think we somehow didn't quite understand the extent to which the infodemic, the fact that all of these extra impacts of the COVID pandemic would really affect the way we can respond. And I think when we look back at COVID-19 and when we look forward to the next event, should it happen in future, and it may, that these are things that we need to preempt. And some of the problems that we faced, we could have thought about ahead of time and preempted and found other ways to work around them. So lots of things to highlight, and there's lots of different groups of people who are looking at both WHO's response, but also responses at in different countries and internationally as to how the way we respond, but most importantly, the way we prepare and prevent these pandemics from happening can be improved.
Thank you so much for that. We've got a question which has come in from Instagram, and I would like to bring this over to you, Sid. And it's with regards to the testing of the vaccines themselves. Now, the one thing we've heard over the many months over this past year is how absolutely rapidly we've been able to develop vaccines and have them rolled out. But of course, in developing any vaccine, there are certain security measures and safety measures which are put in place. This question is about that, and it says, I've heard that phase 2 and phase 3 of testing the vaccine were put together into one testing phase. Is that safe? And I thought it is important to have 3 different testing phases so you can better understand the long-term effects.
Yeah, thank you for that question. So I think at the start, I think I would like to say that we should acknowledge this unprecedented effort being made by the global manufacturers, the vaccine developers, and the researchers across the globe to make this endeavor to have a vaccine product within a year of detection of the virus. This is unprecedented, and I think we all have to salute the people, the forces, the manufacturers behind it, and also the commitment by the governments across the globe. So we have to, in terms of the phases, yes, thank you for asking that phase question. We get this question quite often, David. I think in development of the vaccine, we have 3 phases, phase 1, phase 2, and phase 3. It includes understanding the safety and the efficacy of a vaccine when it will be made available for people. There is no shortcuts in the development of a vaccine. Each and every vaccine will have to go through all of these phases. Phase 1, then into phase 2, and then into phase 3. But let me also highlight what is the basic difference between these phases as we embark on. It makes understand what is the immune reaction to this product, to the protection level being made, following the use of this in the candidate vaccine, as we say. But this also includes increasing number of volunteers being recruited for each phases to get an understanding of the safety of the product and the efficacy of the product as we go along. We can always come to this discussion and say, oh, but in the past, the vaccine was developed over a period of 10 years or 15 years. Now, when we are doing it in a shorter period, does that mean that there has been cutting corners around that? So when WHO assesses the safety and efficacy of a vaccine product, there is a rigorous process of scientific review being done for each of these elements that we have talked about, the phase, the safety, and the efficacy. And all the vaccine products that are either being evaluated by WHO for its emergency use listing or by other stringent national regulatory authorities, this whole process, evaluation of the data is being done very, very robust way. So the set of criteria where all the products are being reviewed. So there is no cutting corners around the safety and efficacy of the vaccine. But let me also highlight this part. Beyond phase 3, when the vaccine is introduced in a community or a population group, the monitoring of any safety events that may happen is continuous. It doesn't end by allowing the vaccine to be introduced in a community. That process continues, and because there could be some rare events which are not being detected by a clinical trial because this is limited number of volunteers being recruited. So that process continues, and that process happens in a country. Whenever a safety event is detected, they undergo investigation. They undergo what we say causality assessment, meaning whether there is any link, a causal link between the event and the vaccination program. And then obviously those results are being shared by the government with the population group, and that is a process which we say is extremely critical to instill trust in the population on that vaccine. So, I mean, yeah, there is no cutting corners in any of these phases, as we have seen of the candidate vaccines that are in horizon.
Thank you, and that's great to know. I do have a follow-up question, though, because you've talked about the stringent regulatory authorities that can say whether a vaccine is ready to be rolled out. But there's also WHO, which gives its approval to vaccines. But sometimes these aren't necessarily in sync. A country bloc such as the EU or an individual country or WHO are giving at different times the go-ahead on these different vaccines. Is that something we need to be worried about? Are some countries just moving far too rapidly ahead, or should everybody be waiting for WHO? So why is there this variance?
No, thank you, David, for raising this. Very, very important to, again, these questions, I'm sure will instill trust in the population groups who will receive this vaccine. So let us be straight on one point, that each country's national regulatory authority should have or should review any of the documents before they allow their own population groups to be vaccinated. So that is for anybody. Everybody should review the documents and the other information that comes through before it is being used. For the European Union member state, as you have mentioned, the European Medicine Agency has got that mandate in most specifically setting in this emergency pandemic setting. They would do that on behalf of all the European Union member states. And that's how you see EMA, the European Medicine Agency, giving the authorization for use in the European Union member state. So for WHO, because within this picture, we do understand that the national regulatory authorities of several of our member states may not have that adequate expertise within their authorities to do a stringent review of all the documents, go through all these entire processes. For those countries, WHO does provide this service to our member state, that we go through a process on their behalf to review all these elements, review all this information, and then that could be used as an index that they recognize the decision of WHO to introduce this vaccine, because this has gone through a stringent process, a robust scientific review. I don't think it's a matter of race, who does it first. It's a matter of us recognizing together as a global community within this regulatory process. WHO works very closely with the European Medicine Agency. We read through the rolling reviews, the evaluation of the products being done by European Medicine Agency. So does also WHO has done with the UK's National Regulatory Authority when they did their review for the Pfizer-BioNTech vaccine. So I think it's a matter of this global community coming together, learning from each other. This also avoids the delay in everybody trying to evaluate from the scratch. So I think it's a matter of this coherent among learning each other, trying to share information through. And I think in this one thing COVID-19 has taught us, I should say, that we cannot be by ourselves alone. It's only by getting together in every front we can be a much better force.
Yes.
I just wanted to come in on that question, the first part of it, because I think it's a really good question, and a lot of people look at the timelines and they say, wow, this has been done in a year, how can we trust it? And what I would reflect on in the broader context of the pandemic is that what we've seen in this pandemic, and we've seen in other emergencies as well, is that sometimes it brings together the political will, the resources, and the know-how to get things done that we've been trying for ages to do in non-emergency, what we call peacetime days, that would never have been possible. And we've seen it beyond the vaccine. We've seen it also in genetic sequencing. We've seen it in surveillance systems. We've seen it in the ways that countries have finally put together these emergency response systems that are really needed to bring a whole of government kind of approach to responding to diseases. So emergencies do create these atmospheres where innovations can happen really quickly, and it's not necessarily that things have been done badly, it's just that it brings together a particular set of circumstances that actually create the potential to do a lot.
Thank you. I've got another question about vaccine. I'm going to start over on this side, and this comes from Barbara on Facebook, and it's about what happens if you receive the vaccine. Can you still pass on COVID-19 onto someone else? I know we're hearing conflicting reports about this. So let's, Sid, if we start with you on that.
Yeah, and thanks, Barbara, for asking that question. And I think let me try to start peeling off the different various layers that we have in this question. The first layer is to understand what does this vaccine design for. That is very important for us to understand. At this point of time, the vaccine, which we have, all the vaccines that we have on our plate, is designed to reduce the mortality, the deaths, or the suffering, those people who are suffering, to reduce the mortality and morbidity from the COVID-19. This virus, or the vaccine, is not designed to reduce transmission or infectiousness of the disease. So it will not be in a position to reduce a transmission or stop a transmission. It will prevent deaths, and that is the reason why when we prioritized who should get this vaccine now, we told that the healthcare workers who are at risk or very high risk of getting this disease or acquiring or transmitting this disease should get vaccinated. The older adults, more than 60 years of age, should get vaccinated because the disease epidemiology showed they are at high risk of getting a disease and also suffering, plus also that they should get the disease. So that is first part of I wanted to set this pace, and so in linked to the fact that this vaccine is not designed to stop transmission of the virus or the infectiousness of this disease. Yes, today if I get the vaccine, I should still continue to adopt and use all the available non-pharmaceutical public health measures that we talk about, hand washing, using mask and other principles, because I can still get the virus. I may not suffer myself and may not die because I have that immunity, but I can still harbor the virus and can pass it on to you who is not been vaccinated because you don't fall under that category yet, and then you can then pass it on to somebody else, or you suffer from the disease.
Thank you. And in fact, I want to bring Katie into this because this was part of my question to you on this. So if I receive the vaccine, then I still need to be wearing the mask and washing the hands and such. Over the past couple of months, as we went further and further into winter, and there was talk of the possibility of vaccines being out there, there was the hope that by spring, by summer, at some point in 2021, we could take the masks off and put them away. We could get our families back together again. We can go and be with our friends and go back to school. Why can't we do that?
Great question, and we're all hoping for that moment when we can return to some sense of normality. And the real way that we can do that is precisely what Siddhartha was alluding to, is to bring transmission levels down to the lowest level possible. And when we have transmission controlled, and when we know where the cases are, where people are getting sick, then we can start to lift those measures and really start to return. But this is the point. So there's two aspects of it here. At the moment, the vaccination rollout that's happening in some, not all countries, but some, are targeting, as Siddhartha said, those people who are at very high risk of having severe COVID and dying. So that's mostly the older age groups. It's people with comorbidities and other chronic diseases. Those are not the people who are actually driving transmission of COVID-19 right now in our communities. If you look at the proportion of people that are really spreading COVID-19, it's not the over 80s, the ones that are being vaccinated. It's the middle-aged groups, it's the people who are taking their kids to school, it's the people who are going out and doing those essential jobs that need to continue to happen. And so transmission will continue among those groups, and they're not being vaccinated, and so they will go on to get sick. And sicker people, the ones that have symptoms, are spreading the virus more effectively. So there will be more efficient spread of the virus through people who are symptomatic or who are getting sick and haven't been vaccinated. So that's why it's so important right now that everyone sticks to the guns of what we know, sticks to the individual preventive measures. Everything that we've been saying in the past year still remains valid, variant or no variant. We know it all works against all types of variants of the virus, and we've got to keep to that. We still need to learn a lot about what the vaccine will enable us to do. We still have very high hopes for it, and it'll take several months though before we get to stages where a lot of the people who are driving transmission in our communities get vaccinated. And that's when we'll see potentially the impact of the vaccine also on transmission, but not yet.
Thank you. There's a question here, it's related to that, from Dan on Facebook. And just before I bring this question in, Sid, just to remind everybody that if you have any questions, please feel free to use the comments section, or you can ask us questions via the hashtag WHO Europe Answers. Say this is from Dan on Facebook. Now, if vaccine is just one portion of what needs to happen, but the vaccines are obviously important. In your position with other diseases and such, there are times when we come across the issue of vaccine hesitancy. Is vaccine hesitancy a concern with this? And if so, because the numbers I hear is we need to get to the world to 70%, otherwise it doesn't work, and So if the vaccine hesitancy is a concern, how do we address that?
Yeah, thanks, Dan, and for that question. So I will try to take a step back and say that vaccine hesitancy, the word in itself, need to be re-looked into. What do we mean? Because that means quite a bit. You know, if we have 20 people sitting here, you ask the same question, they will have a different facet. It's sort of like touching the elephant. It depends upon which part of the elephant you're touching to. So I would say that what we know about COVID-19 related vaccine hesitancy, if I can put it that way, I would say this is about perception of the population towards this vaccine. All the polls that we were hearing, listening to, they said, I would not take the vaccine. And people said this is vaccine hesitancy. But I would say that was a perception of the population, whether they would receive the vaccine, should a vaccine be available, right? And most of the reasons that we have seen from the polls, including the behavioral insights work that WHO European Regional Office has been doing, was around, yeah, I don't know about the safety of that vaccine. I don't know whether the vaccine is effective. And I think those are very valid questions, right? That could also come to you, David, and also to Katie. An unknown agent put on our table, would you take it? Mm-hmm. The first question would be, yeah, I don't know whether this is safe. Once, if I know they are safe, I would take it. Or maybe I will think about it. What I say that these behaviors should be seen as health-seeking behavior of the population. They are seeking more information because they are going to make an informed decision. So within this process, what we are seeing now, the recent polls, and including, which is published in the media though, but also the behavioral insights work from the regional office, there is a trend. We are seeing that more positive attitude towards the vaccine as the vaccines are getting rolled out. The doctors, the nurses are receiving these vaccines in few countries, 35 countries of our region. So people are increasingly seeing that this group, the healthcare providers, are now receiving the vaccine. Tomorrow they will come and provide the vaccine, right? So I think this is the trend that I think we need to monitor. This will also improve further as the population group which is coming to get the vaccine are being provided information about safety, the quality, the efficacy of this vaccine, right? And what does this vaccine does and what this vaccine doesn't do. So I think these type of dialogue need to happen between the health service provider and the population group. This will instill trust in that recipient. And then once one recipient gets this trust, this is a snowball effect. I go to my community and I say, oh yeah, you know, this works because I had some questions, I could get all my answers, and this is what it does. So I think this effect we'll have to see, where to look into much more closely into it. But just to add on one thing, David, you know, we have seen this vaccine hesitancy or people having hesitant to receive the vaccine, not only for COVID-19. We have seen for other routine vaccines as well. We have seen under vaccinated population groups in several parts of our region because of either measles-related vaccines or polio-related vaccine. But I think we all have to acknowledge and understand that the value, potential value of this vaccine. It is an excellent entry, a new kid on the block for this COVID-19 tool set that we have. And I think we all have to do our part in ensuring that the population who is the beneficiary to this vaccine understands the value of that what vaccine is bringing onto this COVID-19 pandemic.
Thank you. But let me bring Katie into this because, yes, I mean, I would fully agree, even for myself personally, if I know about the efficiency and the safety and such of the vaccine, I would be much more willing to take it. But Katie, over the last several months, one of the things WHO certainly has been struggling with, but I think everybody's been struggling with, is the amount of information which is available to people, but it's not always the trustworthy. Whether it's on social media, whether it's in the mainstream media, wherever it is coming from. So how are we able to filter out what is the truthful, the important information, and be able to recognize what is a theory or what is blatant misinformation?
Yeah. Really important, and really important that people take, and I'll use the same term as Siddhartha used, informed decisions, because informed decisions is key here, and there's a lot of concerns that people have that can be reassured through official information, and people can seek that information, and that information needs to be provided to them. What we've seen for COVID-19 is a huge tsunami of information that we've called the infodemic, which has kind of been a sort of pandemic in its own right, and it's become very, very difficult to tease out for a lot of people what is reliable information. So the first thing is, don't trust everything that you do read, and make sure that you seek information from reliable sources. Obviously there's misinformation, so this is information that is not correct, that's spread just through people spreading information that's not correct. But there's also disinformation, which is really intended to mislead people, and there's a lot of that type of information going around as well. So check your sources, identify reliable sources of information, ask your public health authorities locally for official information and for transparent sharing of information, and make sure you don't just blindly follow what other people tell you. There's a lot of things that are going around that are not only inaccurate but false. But I think when it comes to people making decisions about what they do, and one of these things is whether they go and get vaccinated, but another might be whether they decide to quarantine, is as much about informed decisions and the information available to them, but also about the barriers in place at a personal level. So people might not easily be able to travel to a health facility to get vaccinated, and there the onus is really on the health authorities to enable and to have that outreach program to enable people to get vaccinated. So it's a two-way street. It's not just saying vaccine hesitancy is because people don't want to be vaccinated. Sometimes they find it difficult to. And actually, when it comes to looking at the way people have behaved in this pandemic, that has been the driving factor. It's not about people not wanting to quarantine if they think that they may have been exposed to the virus, or people not wanting to self-isolate. It's actually because oftentimes they find it very hard to do so. Maybe they don't have the sick leave that enables them to do so. Maybe they have children or other people in their family that they need to look after. So sometimes it comes down to really practical things that need to be put in place to enable people to go ahead and seek these health interventions that will enable us to curb the spread of the pandemic and overcome it.
Yes, please, go ahead.
So I think, taking what Katie, you mentioned, the immunization program implementation in the countries have taught us one thing, that it's extremely critical that we understand what are the drivers and the barriers to the immunization access and utilization. It could be issues from the population side. We do understand they may have questions, they may have hesitation for one reason or the other. But I think we also need to look into what are the systemic issues which are plugging for the community to utilize the services which is out there. You can have a clinic right outside your door, but you are not utilizing it because the clinic is closed when you are free. And we have seen those examples several times. Just extending one more hour of the clinic, you can have a great coverage because that becomes convenient to you. So we have to really look into very closely about any population which is under vaccinated, they are not utilizing the vaccines. It's critical that we understand and go into a bit more deeper, zoom down to the commune level, zoom down to the local community to understand what is driving them not to use the vaccine, or what is even driving to them use the vaccine, so that the same example or the same modus operandi can be used in other regions who are falling behind. So I think it's extremely critical, as Katie mentioned, need to understand the drivers and barriers for the community, be it vaccination or be it other COVID-19 response measures being put in.
It comes down to let's have a discussion and understand what the actual issues here are. Is it that people believe in a conspiracy theory, or is it actually something that's much more easily addressed and fixed and can be done at the local level or at the government level or at the national level? So I think that's the point here, is that there's lots of things that play into the way people behave, and I think a lot of people have focused on this misinformation and disinformation, which is, it's important and it's true, but in the most part, we all want to get through this, and we're all willing to take those steps that will allow us to get through it.
Thank you. Okay, as far as misinformation, disinformation, or authoritative sources, got a question which has come in from Anki on Facebook, and said, true or false? Is if the question is, if the virus, here we go, is the virus dead or alive in the COVID vaccine? And is this different from vaccine to vaccine? Because there's the big three at the moment, which is Pfizer, BioNTech, Moderna, and AstraZeneca. What can you say about that?
So, thank you, Anki, for asking that question. So I think it's important as let me go back to the first question that I answered, David. When we talked about unprecedented effort, this is also an unprecedented effort in development of a vaccine, because we are using different technologies to develop several vaccines. And all of these, which you mentioned, Pfizer, Moderna, are all mRNA vaccine, while the AstraZeneca is adenovirus-based vaccine. So I think this is important also to understand within this process that the mRNA vaccine uses the genetic material of the virus to produce something which will target the spike protein of the COVID-19, and then in future that protects the individual from getting the virus if it gets exposed to. So an adenovirus-based vaccine uses an adenovirus, a new virus, which then carries on this COVID-19 virus and gives an immunity response to the body, so that when you get exposed, then it protects you from that COVID-19 virus. So I think these are all different technologies being used in the development of this new technology that we talked about. And again, reiterating the fact that there will be few more varieties of the vaccine formulations that are coming. This is not the end of it. And while we are seeing only these coming, the rest of the vaccines which are in pipeline, they are being tested. They are being trialed, as we talked about, that they are all going through these different phases. And we'll get to know their safety, their efficacy, their ability to protect us. And Katie talked about, and we talked about the transmission, right? As newer vaccines are coming out, also the existing ones, we're trying to understand, beyond protecting from severe diseases, beyond protecting us to die from this COVID-19, whether the newer vaccines will be able to stop the transmission at one point of time. So I think these different technologies will provide us to address the COVID-19 in its different phases. Now we want to protect the vulnerables. Maybe tomorrow we would see the transmission being stopped, and then voilà, that's all we want, right, to happen.
And I can add that having these different vaccine technologies, we've got different stokes in the fire here, and as the discussion around variants continues, and just to come back to that first point, that we might need in future, should there be a variant of concern among the many variants that are appearing all of the time, that does pose a challenge to the vaccines, we might need to update the vaccines. Or maybe one of the multitude of vaccines at our disposal will be affected against other variants as well. So this is still the uncertainty that's in front of us, but the fact that we've got so many different technologies there and producing, effective immune response in people, that enable us to have in front of us different options to tackle the virus. I mean, this is a great thing, and all of these will be able to be adapted and changed if needs be. But at the moment, we have no information from the variants of concern that are these new variants that are causing increased transmission that will have any problems with the vaccines. But should it come up, we know that there's the ability to adapt those vaccines quite quickly.
Thank you. Now, of course, there's with the vaccines themselves, it means that they need to be rolled out to all of the populations across the globe, and obviously that takes time for a whole variety of different reasons, including supplies. So, in the meantime, I was checking the numbers just before we started, and the globe is just shy of 100 million people. Or 100 million cases of COVID-19 have been reported. For those who have not yet had the opportunity to get the vaccine, but may have recently got COVID or has had COVID before and is still suffering from the side effects of COVID, what can we offer them as far as advice? What can they do to protect themselves, their health, but also not only for themselves, but for their family around them? Can I give this to Katie to start? Thank you.
Yes, so I mean, we'll expect a lot more people to get COVID in the next few months, most of whom will go on to recover from the disease. Most people continue to have a self-limiting disease. Some people are more affected than others. Some people have no symptoms or no observable symptoms at all and may not even notice that they've had it. So everyone's experience will be quite different with COVID-19, and for some people it's very difficult, and some people the recovery process will be long to get back to normal. Some people will go on to have one of the syndromes that we talk about and are commonly bunched together to be called long COVID, and that needs to be disentangled a little bit, because you do have different types of ongoing sequelae, as we call them, depending on whether you've had the severe form of the disease or the mild form of the disease. But overall, I think, and broader than just the sort of clinical disease itself, I think the mental health toll, the fact that a lot of us have been isolated and will remain quite isolated from our loved ones and from our social networks and physical contacts that we've had to keep by. We just need to band together and support each other and look out for each other, and especially as we may have people we know that are suffering in silence, going through a hell of a lot, that we may not be aware of if they're living alone or not in touch with the networks that they're normally in touch with. So I think it's on each of us to reach out to people who we might not otherwise do, check in on people, and support each other as a community.
Thank you. And just a reminder to everybody, if you have any questions about COVID-19 you would like to ask our experts, Dr. Catherine Smallwood and Dr. Siddhartha Datta, please just use the comment section, or you can send your question via the hashtag WHO Europe Answers. Vaccine question has come in. Sid, I'm sure this is a very simple one for you. I'm sure you get this all of the time. How long will the protection from the vaccine last?
Okay. Yeah, $1 million question, David. No, it's a very valid question, because when somebody is receiving a vaccine, the question would definitely come: how long would the protection last? Shall I need to get this vaccine again next year, or maybe shall I need to get the vaccine again in next 6 months, or any period? So, taking also from the clue what Katie mentioned in one of her responses, that at this point of time, this entire issue around immunity following vaccination, how long would I be safe from the disease after receiving a vaccine, is an unknown element. We don't know yet, and that's a short answer. I know that is not literally what listener would be interested to hear, but I think we have to be honest in telling that we are learning about the vaccine's immunity or following immune protection following the vaccine receipt. We are learning about that more now. And I think as we move further, we will be learning more from all the vaccine effectiveness studies that are being conducted by several researchers, including WHO, along with several of our member states, that will allow us to learn more about this vaccine. So at this point of time, we don't know yet. But I think, and that brings back to the question that you asked in one of your questions, what should I do, or shall I get the disease if I get the vaccine, or can I pass it on to? And that is the point we are mentioning, that don't drop your guards at this point of time just because you have received the vaccine or the vaccine is out there. You have to still continue to do the known effective measures that we have on our plate, including hand washing, physical distancing, use a mask. So that was the short answer.
Thank you.
I would add that we can't assume that even if we had a really effective rollout of the vaccine, we can't assume that on its own we will be able to really curb the pandemic to the extent that we need to do. So we need to continue with the other tools in the toolbox at the same time. We really can't give up on those and just say, okay, we've got a vaccine now, it's going to sort itself out. That's just an assumption too far. And we have other diseases where we do have regular vaccination as immunity wanes. Flu, for example, the seasonal influenza, we have a new vaccine every year. So that's a model that we could move towards.
One of those tools in that toolbox you mentioned, of course, is testing and tracing, etc. And of course, that just keeping that momentum moving, etc., soaks up a tremendous amount of resources. Question from Anita on Facebook: is it better to only test people with symptoms, and are there studies on the transmission channels?
So to answer Anita's question, I wouldn't say better. What WHO recommends that anyone with suspected COVID should be tested, right? Now, that is normally people with symptoms because they display the common signs of illness that we've come to know for COVID. And so that means that most people who will be tested will have symptoms and will be sick. However, and that's the benchmark. I mean, that's the benchmark to make. But some countries can go above and beyond that. And for example, some countries are able, with their testing capacities, to test all contacts of cases. And that's important too. And those are people who may not display any signs or symptoms. And they may go on to have a positive test, but they've not shown symptoms. So that's really, really important. In terms of understanding how the virus spreads between us, testing is important in that respect because it enables us to better understand the dynamics of the transmission, the role that people who don't have symptoms might play in transmission. And without those tools and without those tests, which will improve over time, and they will get even better and better tests as time goes on, we wouldn't be able to understand that. The transmission of COVID-19 is something we're still looking at, and we're still understanding, but we have a pretty good idea that certainly droplets, secretions, and contact with our respiratory secretions is really a driver of transmission. And there can be some circumstances as well where the disease can spread through airborne transmission. That's very well documented in some specific health settings, with aerosol generating procedures, but there's also signs that it could be happening in other types of closed and confined settings. So that is something that we're still generating evidence on, and will continue to do so. And now with these new variants of concern appearing that may be more transmissible, the question is, are they just better at doing what the virus was already doing, or are they doing it in a different way? At the moment, everything leads us to believe that they're just getting better at transmitting in the way that SARS-CoV always did. But there's still ongoing discussions around that, and actually later this week, WHO will be having scientific consultation to look specifically at those variants and looking at how they transmit.
Thank you. Sid, when we do get to the point of vaccines, I'm going to put this in two parts. Part one is, I know when I get it, let's just say for a vaccine for the flu, the first thing they say is, what are you allergic to? And there's something about eggs, which I've never understood. So there's that. So is there a possibility of people being allergic to any of these vaccines? So that's part one. But after receiving the vaccine, do we have any information on the side effects from these?
So thanks, David. We'll find the time to talk about the egg allergies for sure. Now, so we have to understand about that. When we do the trials and other things we talked about, we try to identify what are the possible common side effects a vaccine recipient can suffer. There could be minor, like sore at the injection site, a bit of fever after you receive it, or feeling lethargic, or those type of minor events that we say. Those are very common, and that gets detected during in the clinical trial phase that we discussed. There also could be some rare events that can happen which may not always be detected during the clinical trial phase, and that's why when it gets rolled out into the general population, the health system tries to identify this, investigate, and file the causal link. Okay, so based on the information that we have thus far from the vaccines that have been rolled out, we have seen some of the side effects. We have seen issues around severe allergic reactions that we have heard from the UK. But then these rare events, there are also few other rare events that are being reported by few countries, which is really great. I think this is extremely important, that any of these side effects or events, as we say, that has to be reported. And then the process of doing a detailed investigation to find out the causal link between this event and the vaccination have to be established. And that process is happening in almost all the countries where these vaccines have been rolled out. So yes, we know of some of these events that have happened, but I think more has to be learned. We need to keep our eyes and ears open. The health system should be responsive enough to identify them, investigate, and then let the broader community know whether there have been any causal links.
All right, thank you. There's a question I'd like to go to from Paul on Facebook. And his question is, my mother has just died from COVID in a care home. Is there any information available on when it is safe to collect her belongings from her room? And first of all, Paul, we'd like to thank you very much for sharing this question with us. And certainly our condolences on your loss. Katie, can I give you this question, please?
Yeah, thanks, Paul, and also condolences on my part. It's terrible what we've seen unfold in a lot of nursing homes and long-term care facilities where incredibly vulnerable people have been affected by these quite explosive outbreaks of COVID-19 that occurred, very dramatically last year in the first peak of COVID-19 in Europe, where up to 30, 40, 50% of the COVID deaths occurred in those types of settings. So there's been a huge toll on our most vulnerable and treasured members of our society. In terms of collecting belongings in a dignified way and giving some thought and time to processing the loss of someone, including through their own artifacts and things, we've got to also be very careful about the appropriate way in which the belongings and the linens and objects that person has come in contact with don't go on to pose a risk. So I'm sure in that particular setting at the long-term care facility, there's an appropriate system in place whereby workers at the facility will be able to disinfect and make sure that all of those objects are dealt with whilst protecting the health of the workers there, and then they will be returned. But equally, when we're talking about looking after people at home, it's really important to ensure that that those people are, if they're at home, in a setting where they don't go on to infect other people in the household. And I think that's a really important part of examining what the structure of the layout of the residence is and whether it's suitable for home care for someone, that they have their own space, that they have their own bathroom that they can use. And then when that person has recovered or whether they're moved to a health facility, that appropriate environmental cleaning is done of the area so that there's no ongoing or latent risk to anyone else entering or using the facilities or the linens or the beds or whatever it is. So WHO has very specific guidance both for nursing homes and other facilities like where Paul's mother was looked after, and we also have specific guidance for people who are taking care of people who are sick at home.
Thank you. In the couple minutes that we have left, one of the things we haven't talked about is the mental health. Due to all of the social distancing that has happened, due to the various lockdowns across the globe, etc. What advice, and especially we've seen lately across Europe, that a lot of countries are going into lockdowns or pseudo lockdowns. What advice would we give people who were facing yet another one of these waves with regards to just protecting their mental health?
There's some. I'll start off and happy to for Siddhartha to chip in as well. I mean, there's some very specific things that we've repeated all along during this pandemic, is that physical distancing shouldn't be social distancing, and that we need to continue those social interactions that are so important for our mental health. And if that's not through the ways that we used to do it, then we need to just find other ways in which we can interact with people. And actually, on a personal level, I've found myself interacting on a social level with groups that I hadn't been before, immediately before the pandemic. So in fact, where some doors close, other doors open, and I think that's hugely important for us to take advantage of and to jump into it. And it's been very useful, both for myself, but also for other people I know. But then the other component of this is, if people need additional support on mental health, they need to reach out to their mental health providers if there's an option for that. And health systems need to ensure that those services continue, and especially mental health, but also all of the essential health services that have taken a knock during this pandemic need to be adapted so that they can continue to function during COVID. And yes, we have seen an increase in mental health issues, and that's partly because of the disease itself. It's partly because of the grief and the darkness that it's brought, but also because of the socioeconomic impacts on a lot of people's lives, and that needs to be taken into account in these health systems. There will be this very significant demand that has been building over time gradually, that will see far outlive the pandemic itself. And those consequences will continue to reverberate. And as much as we can do individually, the systems need to be prepared now for that long-term impact of COVID.
Thank you. Sid, in the 30 seconds that we have remaining, I'm going to give the last word to you. As I said right at the very beginning, we're 1 year in to this pandemic. But recently we've had the vaccines rolling out, etc. Looking down the road into the future, is there some hope? Is there some good news that we can be keeping our eyes on?
Yeah, thanks, David. I will try to be short in your last 30 seconds, as you say. Only thing I see moving forward is opportunity for the community, for the national governments, for the immunization program anywhere in the globe. The entire scale of this rollout will be tremendous. The national immunization programs in all the member states of the globe, we haven't done it in this scale. So this provides us opportunity to look into what are the immunization system elements that can be strengthened, and this COVID-19 vaccine rollout and vaccination can be seen as an opportunity to identify those gaps in the system and then strengthen, because any investment the government would be doing at this point of time for COVID-19 will have a big implication for strengthening and having a resilient immunization system tomorrow. So that is where I would rest my case. Thank you.
Thank you. And I think that's an absolutely wonderful way to end. I would like to thank very much Dr. Siddhartha Datta and Dr. Catherine Smallwood for your time this evening. But I especially would like to thank all of you who have been following us through this Facebook Live event. And thank you for submitting all of your questions. Remember, if you're looking for information on COVID-19, please go to our website, www.euro.who.int, or the website of our headquarters at who.int. Until the next time that we can meet up for another WHO Europe Answers, to everyone, please stay safe and stay healthy. Thank you so much. Thanks.